differential according to education. We can see that there is a gap across time for both men and women. It broadly seems to be increasing across time, but we're only looking at a sort of short run. I think the earliest data here is from 1992, so we're not really getting a long-term sense for this data. Now, historical data looking at this question is particularly rare, and it tends to be at the aggregate level. So this is data that is looking at the UK. And what we can see is that there's quite a long run in if we're looking at life expectancy at birth. If we want to look at life expectancy split according to certain thresholds, so given that you've reached the age of 10, age of 25, and so on, we can see that that's something that's a more recent phenomena. But we can see that there's a general increase across time, and the greatest increases seem to be given that you've survived childhood. So I think this leads us to make two fairly uncontroversial statements. The first is that society's poorer, less privileged people live in worse health and they die younger than people who are more privileged. And the second uncontroversial statement is that until now, we've only really had cross-sectional data to look at mortality inequalities. We've had these snapshots, or where we've had a temporal view, it tends to be the general population rather than being able to disaggregate across different groups. But if we step back and think about why we think there might be this association between wealth and health disparities, there are a few core theories that I want to unpack in the next few slides. So the first is the theory of fundamental causes. So this is a really seminal piece of work from about 20 years ago, looking at why we might expect there to be differences between those who are wealthier and those who aren't. And there are four key components to this. So the first is that fundamental causes like wealth or lack of wealth lead to multiple disease outcomes. So if you're somebody who has fewer assets, you can imagine that there's an increased risk of lots of different diseases, not just one. But also the outcomes are mediated through multiple risk factors. So if you take something like lung cancer, for instance, you might imagine that people with lower incomes might be more prone to this, partly because they might disproportionately smoke at higher rates, but they also might be in the type of jobs where they experience passive smoking. They might live in areas with poorer air quality, and all of these things will come together to increase their risk, not just one single thing. And another key thing is that the resources that people have will help them to avoid certain diseases and minimize the consequences. So during the pandemic, some individuals were potentially, let's say if you're living in a very urban area in London, maybe you live in a tower block, it's very difficult to avoid coming into contact with people. Maybe you get a bus to work. Maybe you can't work from home because of the type of work that you do. Now, if you contrast that to somebody who's working from home, maybe in the Cotswolds in a rural area, that's much easier to sort of avoid being contaminated, and you're able to sort of buffer yourself against these risks much more. And the final thing is that the wealth mortality gradient will persist and reproduce itself. So in the past, we may have seen that the gap was caused by, let's say, unsanitary conditions. Once that's been overcome, or once vaccines have been introduced, you might expect that that will level the playing field, but then of course new things come along. So for instance, diabetes comes along and we see differences in people's access to healthful food, for instance. So each time we overcome one specific instance, there'll be other instances that come into play across time. So it's a game of catch up. And I think this is a really nice quote. So medicine is a social science and politics, nothing but medicine at a larger scale. So this is the idea that what we're really interested in with medicine is understanding the social context that leads to health. But the key issue, as we've said, is that historical data is often compiled through these snapshots. So we have lots of pieces of evidence that we're trying to put together, but it's hard to get the continuity because we're comparing different things in every study, and finding a coherent picture is a real challenge. There are some particularly important snapshots nonetheless. So Chadwick, in his work of the 19th century, looked at the sanitary conditions of labourers in Liverpool and found that those individuals had pretty low life expectancy, but in particular, it seemed to be segregated according to the type of work that they were doing. And then more recently in the Whitehall study, again, really impactful evidence showing that lower levels of job seniority were associated with higher mortality rates. And then more recently, this paper in the Lancet Public Health from a few years ago shows, again, the relationship. So on the x-axis for all of these plots, we go from the least deprived to the most deprived local authorities in the UK. And we can see that as areas become more deprived, we see lower life expectancy for both men and women. And we see this with respect to the left panel, which is poverty, the middle panel, unemployment, and the right panel, which is education. Now, there is some evidence suggesting it's not always been this way. So I'm going to discuss here the peerage paradox. And this is a really interesting phenomena that's been proposed, and Fogel talks about it in his work looking at health inequalities and nutrition. And he points out that for a long time in British history, the English peerage had a very similar life expectancy to the general population. And it's only from the middle of the 18th century onwards that we start to see this pulling away, where wealthier individuals are living longer. And Angus Deaton picked this up in his work, The Great Escape. And he says the first lesson is that this gradient in health is not universal. We didn't see it in Britain for at least 2 centuries. And the idea here is that innovation is the key here. So initially, there was a very similar life expectancy, but then what you start to see at the end of the 17th century, towards the 18th century, is that innovations start to emerge. We start to know more about how to live healthy, long lives. And initially, what you see is this breakaway of those who have the access to the knowledge, the money, the resources to be able to implement these changes. And then one might expect there might be a catching up of the general population. And just to show you the evidence that's been used to support this, here we can see on the x-axis, we're going from the 16th century up to the 19th century. And we can see the general population's life expectancy is pretty constant across time. And then this is the evidence that's been used from Hollingsworth. So you can see the blue dots are showing the aristocratic families in the UK. In England, initially, it's a very similar life expectancy, but then you see this divergence where innovation is happening, Deaton would claim, and then we're seeing that there's an increase in life expectancy for those who are the elite, but not for the general population. Although, as a bit of a spoiler, some work that Charlie and Aaron and colleagues are doing suggests that actually this might not be the case. So they have done some revised estimates controlling for some potential confounds, and actually they see that potentially there was always a difference that persisted across time. But this is an ongoing debate in the literature. So to summarize the work that's been done so far, historical demography tends to be a snapshot in time. It's often very regional. It will often have unrepresentative samples. So for instance, looking at our peers is really interesting, but it doesn't tell us more generally about the role of wealth. And we also often have very small n when we're looking at things, for instance, parish records. So what I want to do today is present some work that is trying to overcome these barriers. And in this work, we use deep learning and optical character recognition to combine what we think is one of the most detailed analyses of health inequalities in the long run. And I'm going to give you a bit of a roadmap now, just to tell you a bit about the broad contours of the type of data that we have and the analysis that we're using. There are 4 key types. Oh dear. 4 key types of data that we're using here. The first and most important are probate records. So this contains all of the wills and administrations that have been proved in the UK for about 138 years. We're also going to use death registry data for all the 66 million deaths that occurred in the UK for a comparable period. We're then going to use genealogical APIs to try and stitch people together to see how money flows through and how life expectancy in families is transmitting. And then finally, we're going to use APIs to estimate people's gender based on their names. The process to get from these data assets to our output involve web scraping of 1 million pages, image cleaning with computer vision, text extraction and with optical character recognition, and then a merging of the data and a construction of family trees. And the output that I'm going to present is a database that includes, for everybody who's died across about 140 years, we've got age of death, gender, wealth at death, including no wealth, ancestral wealth, family life expectancy, which gives us an approximation of genetic life expectancy, and children's longevity. And then we can use some typical demographic techniques to try and unpack the impact of wealth inequality across time. So I'm going to introduce the first type of data first. This is the probate registry, and this is a digitized collection of all the wills that have been proved in the UK from 1858 to 1995. And with very, very few exceptions, every individual who left behind an inheritance will be listed in these records. Certain members of the royal family, for instance, won't be, but pretty much everyone else is included. And you can get into the probate records in two ways. So the first is via a will. This occurs when an individual leaves a will behind. This could be a big amount of money or a small amount of money, and they formally express what they'd like to happen to their estate. Administration happens where a will wasn't created, but the value of the estate is above some threshold. And this changes across time, as we'll see, but on average, it's about £5,000. So in today's money, so modest sums of money. And it truly does contain everybody that you might think of. So this is the actual will, the probate record of Charles Dickens. We can see who he left his money to and how much money he had. We can even see the street where he died. We can see Charles Darwin as well. We've got Virginia Woolf. It's Beatrix Potter. And we've got Alan Turing as well. We can see who he left his money to, a librarian. And we can see Winston Churchill as well. And we can see that he left money to his wife Clemmy and to his daughter as well. But we can also see millions of more modest wills as well. So these are just three people that I'm sure none of us have ever heard of before, but I found in the records. For instance, John Croxton, I found, and this is a labourer who died in the 19th century, and he left £5 to a farmer, so about £600 today. Or Lionel Abbott, who died in the 1920s and left the equivalent of £4,000 today to his son. Or Susanna Chilvers, who died in the 1960s and left £211 to her bricklayer son and homemaker daughter. So we're not just capturing the elite here, we're capturing everyday individuals who had modest sums to leave behind. So to get all of this information, we needed to scrape lots and lots of pictures of wills from the government website. So we set up 138 virtual machines in Amazon Web Services, and that was one per year. And we sent requests on a rate of, on average, 10 seconds. I should say that we were very keen to make sure that this was done in an ethical way. So we had a friendly user agent message with my email address in case the people who run the website, the government, were upset that we were potentially trying to have some kind of cyber attack. And we made sure that we adhered to all of the robots .text guidelines as well, so that we weren't doing anything that would overwhelm the server. And then we used wildcard searches to rattle through all of the surnames that could exist, and we saved the images for further processing. So this resulted in 1 million pages of images, and if you stack that vertically, just to give you a sense of the scale, it would be from the start to the end of the 100-meter line. So it's a lot of images that we've got here to process. Okay, the next thing we needed to do was turn these images into data, and that required a lot of cleaning and computer vision coding to try and identify what was information we wanted and what was information we didn't want. So I'm just going to show you an example of what we did here. We would take a page, and the first thing we'd do is work out if it was white on black or black on white, because a lot of the algorithms don't like it when it looks like this. They're trained to make it look like this. And then we would convert it from grayscale to a binary black and white image. We would then calculate if there was a skew by looking at the angle of the pixels. So that's what it looked like before, and then we'd sort of straighten it up. And we'd identify any blobs that might be ink blots, for instance, and we would remove those. We would do some margin detection using regressions so that we could clean the margins. And then probably the most fiddly thing was training it to know the difference between handwriting and machine text. I found out a couple of years later after we did this that AWS had implemented something to do this, but when we initially did it, they didn't. So we had a go. So we'd find the handwriting, we'd remove that. Then we'd identify any dust, remove those, and then we would bound the text so it would know when one entry started and one ended. And then we would group it together so you'd know it was one person. And I should say that, oh, and then the final thing we do is we resize the page based on optimal character extraction. And so much of this was based on having a wonderful team of research assistants who helped us get the optimal parameters so we could train our deep learning model. So thanks very much to them. There were lots of different types of pages across time. So that was an example for one specific year, but we had to train it for all of the different years. So you can see these are the early years, and then in the corner you've got the 1990s. The pages look very different, so we had to train for each of those scenarios. Okay, so once we had this and we had all of our little bounding boxes telling us where a certain entry began and where one ended, we were then ready to use optical character recognition to extract the text. So what we do is we take an image. This is an actual image from the 1990s. And we use Amazon Textrat to extract the data. Now, you might be able to see, because you're not a machine, that there are some issues here where there are some typos. For instance, that word is obviously meant to be February. And after Bristol, it should be 19th March, not 1G March. We were able to use large language models and BERT to clean that up. So instead of us having to look individually, we could do that cleaning. And then finally, we used fuzzy regex to extract all of our information. So for every individual in our data set, for the millions of pages, a million pages, we were able to extract these pieces of information for our individuals. So this resulted in a cache of 18 million probate records. And just to give you some confidence, I hope that we were able to do this in a way that we would expect for the number of probate records. Here I'm plotting all of the deaths from our time period, from 1860 up to 1990. So these are all the deaths that are reported in the Human Mortality Database. Based on Rubinstein's work, which makes estimates of the upper and lower bound number of probate records we should expect to see per year. So in the early years, I think 10% of people left probate. In the later years, it's maybe between 20 and 40% or something like that. So this is where we want our estimates to be. And this is what we observe. So we observe for virtually every year that our estimates are within this bound. So it suggests that we are extracting the right number of records. We can also put the threshold changes across time here. So here we can see when the minimum threshold for leaving probate went from £10 to £50, for instance. So what you see for most of these is that it's at the upper bound just before the change, and then it, because the thresholds have gone up, fewer people are caught into it, so it tends to dip. So that gives us some confidence as well. Okay, so that tells us how we managed to identify wealth at death for our sample. But of course, we don't know from the probate records how old people were when they died. So this involved collaborating with a wonderful charity called FreeBMD. And their mission is to make all of this information about people's family ancestry publicly available and free. And it's also one of the first ever crowdsourcing projects. So this is a charity that has been open and free and active since 1998. And people have been going onto this website since then to look at images and to transcribe them so that people can look up their ancestors online. They've had a team of about 13,000 volunteers across this time, and they've processed about 400 million records. So a tremendous example of people contributing to the sort of crowdsourcing initiative. And as of the 27th of September, 100% of records up to 1990 have been transcribed, and they're currently working on 1991 at the moment. So I'm just going to give you a snapshot of what these look like. This is a page that somebody might go into to look at, volunteer, and then they will just type out all of this. So I can go onto the website and I can see the individual who transcribed this was J.S. Coleman, and I can see how J.S. Coleman, how he or she transcribed this, and I can compare it and see that they've done that successfully. So we purchased this data of 66 million deaths, and this is what it looks like. So I've just plotted out here the age at death for the total population, excluding infant mortality, excluding child mortality, etc. And it does look remarkably similar to what we find from the ground truth from the human mortality database. So that gives us good confidence in the transcribing. The next step was to combine the two. So here we've got our probate records, and what we would do is we would look up an individual based on the quarter in which they died. So 3 of these individuals we know died in Q1 1940, so we would look them up there. And 1 person died Q4 of 1939, so we'd look them up there. And of course, if there's only 1 person in there, it's very easy to identify. We'll just match and merge the 2 so that we'll know William Ackroyd had a certain wealth and a certain age at death. Now, of course, sometimes there'll be multiple matches. So in those scenarios, we will first remove anybody who was under the age of adulthood because they wouldn't be in our probate record. We'd then match on middle name. And if we still had 2 matches, we would match on the location of death. So here we know that Ruislip is in Middlesex, so we would match this individual here. If we still couldn't match somebody because there were multiple matches, then we would have to lose that record, but it's quite unlikely with all those parameters that you'd have multiple matches. So this is where we are at the moment. We're still working on trying to improve some of these records. So I imagine the number of matches will go up. But of our 18 million, we've currently managed to match 62%, and the rest are an equal split between multiple matches or no matches. But we are hopeful that we can increase that. So what does this all result in? After all of these steps, we have a data set that really gives us a true snapshot of wealth at death and age at death for the aristocracy, for the middle classes, and the working classes in Britain across 120 years. So we have a data set that includes virtually all individuals who were members of the aristocracy from that time, anybody from the middle classes who died in that time. But we also have individuals who would have been from a working class background as well, where we can infer no wealth at death. And crucially, all of these individuals in these photos, if they died before 1990, we believe that they would be in our data somewhere, either as having some wealth or as having no wealth at death. So we then move on to our demographic analysis, and we attempt to make life tables for comparison across lots of different cuts of the data. So we make estimates for by gender. Gender, I should say, is inferred by looking at the first name of the individual. It's not perfect, but across aggregates of lots of millions of people, we believe that we are getting a useful signal there. We're also calculating tables for each year. We use different rolling windows of 1 year, 5 years, and 10 years. And crucially for our analysis, we group individuals as being part of the top 1% of the wealth distribution, as being somebody who had some wealth at death, so they're in the probate, non-probate, which are people who we believe had no wealth at death, and then all of our data, which is just the population of the UK. So this results in over 9,000 life tables across time. And if anyone's more interested in the specific details, I'd be happy to walk through this. Okay, so let me get to the results now. The first thing we look at is age at death. So we can see here a few things. The first thing is, as you would expect, women tend to live longer than men across our sample, and life expectancy increases across time. And we see a dip around 1917, which is a combination of the First World War and the Spanish flu. We can then look at age at death by the amount of money that people had. So here we take the individuals who had some money and we split them into quartiles. So this is what we see in the bottom quarter of people who had some wealth at death. These are the individuals who were in the 50th to 75th percentile, so pretty similar, maybe slightly higher in these sort of middle years. And then we start to see that people are living longer in the 25th to 50th percentile, but that the gap seems to be closing across time. And then here we can see the top quartile of individuals. So a few things stand out from this. The first is that the wealthiest are always longest lived. The mean age at death drops comparatively less during shocks among the wealthiest. So if we look at the drop that we have in the lower colours, we can see that they're much more extreme, but there seems to be a buffer against these shocks for the people who are wealthier. And we also see that the impact of wealth appears to be decreasing across time. Although, of course, in these plots, we're only looking at people who had some wealth at death. We're not looking at the people who had no wealth at death. We can then also look at the age at which people are dying. So is it the case that people are living longer because fewer people are dying very young? Or is it that some individuals are just living much longer? So these plots require a little bit of unpacking. But what we see for each of the panels is we see younger individuals, your life expectancy given that you were 20 at the top, and your life expectancy given you reach 90 at the bottom. And then from left to right, we're going from the 19th century up to the near present day. And bluer areas are examples where non-wealth individuals are dying at a higher rate. So what we see is that the bluest areas are among the young individuals, but things are getting less blue across time. So this means that the difference between the number of 20-year-olds with high wealth and low wealth dying is decreasing across time. And we're also seeing that there are more red cells earlier on in our sample. So what this means is that in the earlier period, it was only wealthy people who were living from their 70s to 80s to 90s. But we see a lot more equality as we go across time because there's less red. So people are who are living to that age are just as likely to be from probate versus non-probate. So it suggests that there's more equality at both ends of the distribution. So we observe decreasing inequalities across time when we're just looking at age at death. And the difference in years lived by those with some or no wealth is declining. And the difference seems to be biggest between the top quartile and the bottom quartile, but that seems to be declining across time. And if we look at the distribution of ages, we see that those without wealth die disproportionately young, but this gap is decreasing. And we also see that in the past, it was only wealthy people who are living to those very long ages, but now it seems to be more individuals across the wealth spectrum since 1945. So although age at death provides us with a snapshot, it gives us less information about the survival chances that people have. And for that, we need to use life expectancy models. So this is saying, given you were born at a certain age, what age do we expect you would live to across time? So these are our life expectancy estimates, and we're looking at this with birth cohorts. So we're looking at all the individuals who were born in 1845 versus those that were born in 1846, and so on, and seeing how their life expectancy changes across time. So these are the individuals in our data. This captures everybody in our data here. We've got on the left, we've got men, in the middle, we've got women, and on the right, we've got everyone. Here we can see the individuals who weren't in the probate data. So these are the individuals that we believe had no wealth at death. These are the individuals in our probate data. We can see that there is a narrowing here between the groups. And then these are the individuals who are in our top 1%. So the gap between the probate and non-probate seems to be shrinking, particularly relative to the top 1%. We can also look at lifespan equality. So this essentially is a measure of how fair life expectancy is across a cohort. So in a world where if I know that the life expectancy is 80 and everybody lives between 78 and 82, then that would have a high equality. But in a world where the age is 80, but lots of people die at 40 and lots of people die at 120, then you would have high inequality. So this gives us a measure of how well somebody can predict how long they'll live based on their life expectancy. And what we find is that wealthier people tend to have more predictable lengths of life. So it's a much easier prediction for those individuals to make. Those are the blue individuals in the top right relative to the non-probate. But what we also find is that equality is increasing across time. So there's less surprise in how long people live across time. And we also look at, across all of our 9,000 life tables, we have a look to see the point at which they show that people are dying disproportionately from no wealth backgrounds versus higher wealth backgrounds. And what we can see for all of these plots is that up until about the age of 66, 67, the individuals who are dying are disproportionately no wealth individuals, but above that age, it's disproportionately people who have some wealth. So for both men and women, for all cohorts in our sample, and for almost all ages, we see enormous stratification by wealth. And we do find that this gap seems to be narrowing across time. So wealthier people always live longer, but the gap between the wealthiest and those with no wealth or those with low levels of wealth does seem to be narrowing. And what we seem to find is that the greatest gains occur by fewer people dying in early adulthood, particularly among the poorest. So we're lifting up those individuals. We also see that lifespan equality is increasing with wealth, and it seems to be increasing across time. So you've got less of this variation of people living at very different lengths of time. It's becoming more uniform. So all of this sounds like good news. It sounds like inequality is shrinking and things are becoming fairer. Well, this is just looking at people's wealth at death. It doesn't tell us anything about their backgrounds and how they got to have wealth or have no wealth. So to do this, we've looked at family trees. And I'm going to introduce another example of crowdsourcing. This is another fantastic website, which involves individuals piecing together records to try and stitch people together and make a huge family tree. Their ambition is to have one global family tree one day. And they have an API, which means that we can scrape these family trees. And they have, as of about a year ago, they had 36 million records. Not all of those are based in the UK, but a good chunk of them are based in English-speaking countries, including the UK. So let me give you an example. Let's imagine we've got somebody called Anne Adams in our probate records, and we know that her maiden name was Baker. What we can do is we can try and find her parents, Brian Baker and Bessie Baker, Nate Dixon, and then we can see if grandparents are there as well. So here we've got a missing grandmother, but otherwise we've got 2 paternal grandparents and 1 maternal grandparent. So we can make these connections with the individuals. And we can also do the same looking at Anne's children and grandchildren if she has any. And then we can stitch this together with the data that we have in our probate records. And not only do we know how people are related, but we know the age at death for her parents and grandparents. And we know if they had any wealth at death. So here we can see there's one relative, David Dixon, who didn't have any wealth at death. We don't know what happened to David Dixon's wife. She's not in our records. But for everyone else, we can make an inference of how much money they had prior to Anne's death. And what this means is we can look at how parental wealth predicts life expectancy and grandparents as well. But we can also look at how wealth predicts children's longevity as well. And what we find is that there seems to be a particularly strong effect for the top 1%. So here we're looking at your life expectancy, given how much money your parents and your grandparents had. So we can see that individuals who were born into low or no wealth tend to have a life expectancy across our sample of 60. Those individuals who have some wealth, excluding the top 1%, live marginally longer, maybe 62. But then we see the top 1%, we're really starting to see the gains. So for those individuals who had family connections who were in the top 1%, we see they're living to 80. And we can also look at this across time. So this is looking at the difference between our baseline, which are people with no wealth, our blue line, which are people from the top 2% to the top 10%, and then our top 1%. And what we see is that inequalities are growing across time. So although we saw earlier that the amount of money I have is becoming a weaker predictor of how long I'll live, we're seeing the money that my parents and grandparents had, so my affluence in my younger years, is becoming a stronger predictor across time, particularly for those 1% individuals. So this suggests something quite different. It suggests that inequalities are deepening across time with respect to childhood wealth. So this analysis suggests that your parents' and grandparents' wealth, which we can think of as an approximation of affluence in childhood, is becoming a stronger predictor of life expectancy. So although my personal wealth is becoming a weaker predictor of my life expectancy, the money that was in the family when I was a child is becoming a stronger predictor across time. Now, of course, these two things are highly correlated, but we can think of examples that would be different extremes. So you could think of a sort of rags to riches story of somebody like an Alan Sugar being the example of somebody who had modest upbringing, but had high wealth later in life. In the earlier period, that would have made a really big difference to an individual because they would have been able to afford a better lifestyle. And you can think of the other example as somebody like a Francis of Assisi who grew up in wealth, but gave a lot of that wealth away. And that type of relationship would become increasingly important later, but not so much earlier in our sample. So to summarize what we find that there's a significant reduction in the wealth-health gap when we're looking at people's wealth at death. So we find the disparity between the wealthiest and the least wealthy has narrowed a lot since the Victorian era. There still is a gap, but it's narrowed considerably. But we also find the influence of parental wealth on longevity is increasing. So the extent to which an individual's parents and grandparents had wealth is becoming more important in predicting life expectancy. So it suggests those early years are particularly important in our sample. And we can also find that a lot of these inflection points appear to be around 1945, which, of course, we can think about the introduction of the NHS and the welfare state as being a potential moderator for this relationship between wealth and health. So what does this mean for the theories that we talked about earlier in the presentation? Well, for fundamental cause theory, it seems to support the idea that health inequalities are persistent. So we see evidence that across time, the impact that people have access to knowledge, resources, wealth, power, prestige are continuing to be particularly important. And we don't see that it's a case of us just overcoming a certain ill with respect to people's health. It seems to be something that is enduring and persistent. But we also see evidence that interventions can mitigate against these health inequalities. So what we find is that there is a narrowing since the 1940s, and this coincides with the introduction of the National Health Service and the welfare state. So it suggests that large-scale interventions can mitigate against some of these fundamental causes on health, at least temporarily. And it also challenges this idea that it's something that's deterministic. So I think there is a note of optimism that we can have things that disrupt these mechanisms under which the fundamental causes operate. So if we think about what this means for fundamental causes, it suggests that economic changes and policy interventions can alter this relationship that we see, and that we need to think about the broader social factors, things like industrialization, and the welfare state, and that it's a much more dynamic relationship that we're seeing. If we think back to Vogel's peerage paradox, it also challenges this idea that there is a stability in health inequalities, which Vogel would agree with. But nonetheless, it suggests that this idea of family backgrounds, these parent-child dynamics are particularly important. And we need to think about the role of inherited wealth as well when we consider these models, not just people's access today, but their experiences earlier on in life as well. I think it also speaks to Deaton's work too, thinking about the role of innovation and how this is something that initially could benefit people who are from elite backgrounds. So what we do seem to see in our data is that there is, as we saw after the peerage paradox, there was this pulling away of people from elite backgrounds, but then there seems to be this catch-up effect, which Deaton would anticipate. You have these sort of early adopters from elite backgrounds, and then other people are able to potentially adopt these innovations as well. So to summarize what we find in this work, we're able to put together a database of super long-run health inequalities to find that wealth, although it is still a really powerful predictor of health outcomes, these are things that do change across time. We see that there are structural changes that seem to be disrupting these dynamics, and we seem to see that there's a weakening of certain impact of how much money people have that they accumulate throughout their life. But at the same time, we see that there is an increasing importance of wealth and affluence in early childhood. So I think I'll leave it there, but thank you so much for your attention. I'd be really keen to hear any thoughts that you might have, any feedback, and I just want to thank all of my collaborators and our funders as well who supported the work. Thanks very much.